So we are talking about pathologies. So yesterday we talked about esophageal pathologies. Today we'll discuss because without knowing pathologies, we cannot able to see the report and study properly. Okay. So here we have some important pathologies, not all to be covered. Okay. So stomach pathologies in the GIT tract, we have four important organs. One is esophagus, second is stomach, third is small intestine, and fourth is large intestine. Okay, small intestine, esophagus. Yesterday we discussed. Today we'll discuss stomach, small intestine, and large intestine. Important pathologies. So here, one in the stomach, we will have one type of condition, pathological condition. It is called infantile pyloric stenosis. Infantile pyloric stenosis. We know that there is a pyloric that is present in the lower side of end side of abdomen where duodenum will start. This is the C shape. Here we have the C shape area. In that, in front that we have pyloric sphincter. So pyloric sphincter is normal closed system. So to protect the entering of the food which enter into the small intestine, reverse the food from the small intestine to the stomach. So it is protective, or from the stomach to the duodenum. Okay, without doing proper digestion, it cannot go to the forward. So what happened here? Pyloric stenosis, pyloric width and breadth. Okay, all will increases. Okay, so it is by birth. So that's the reason we are called infantile. So not only by birth, not by birth, if after 2 to 3 months, after birth of 2 to 3 months of baby, it will occur. Okay. So how do you notice that? They are simple symptoms like vomiting, non-biolic vomiting. It is the food what we eat, it will come outside. Okay. And if you do the scan, so upper GI's endoscopy is the investigation of choice. So if you check the pyloric stenosis, it will length is 16 mm and breadth is 4 mm. So more than 16 mm, more than 4 mm, it is like infantile pyloric stenosis. So in that, the investigation of choice is upper GI. So with the help of endoscopy, you can easily see the uh, pyloric sphincter. Okay, this is the most common condition. After that, we have the most important type of pathologies that is in the stomach is stomach ulcer. We also call gastric ulcer. So ulcer means that the mucosal lining is disturbed. We have layer mucosal covering due to the excess amount of acid. So the mucosal lining is damaged. Okay. So what happened to the stomach? The stomach mucosal lining is damaged. So that's the reason they have ulcer type of condition happen. So patient have nausea, vomiting, or sometimes dark color stool, blood vomiting, loss of weight, feeling bloated, always burning sensation. Okay, all this due to the stomach ulcer. Okay. So for that, the investigation of choice is upper GI or upper gastrointestinal endoscopy. With the help of that, you can see the esophagus as well as stomach. So this is the investigation of choice. So you doesn't need X-ray or sometimes CT scan. Upper GI will tell you the detailed information of stomach. Okay. So this is the important one. Second, after that, next we have bowel obstruction. Bowel obstruction is nothing but any obstruction will happen. We have different types of obstruction. One is herniation. Herniation means it is coming out of space due to the damage of protective wall. Adhesion to two guts are attached. Second is any tumor, cancer, or intersusception. Intersusception. It means that due to that the bowel, inner bowel, outer bowel, both are mixed, volvulus, any type of tie, foreign object is situated. So for that, these are all types of bowel instruction obstruction. So what is the investigation of choice? The investigation of choice is CECT. So the contrast CT is advisable to see the obstruction where the obstruction is happen. So we'll get the patient need the dye. So contrast will be given to see the location of the obstruction in the large intestine, mostly large intestine, small intestine, anywhere, wherever the pathological conditions happen. Basically, it is a clinical condition, not pathological condition. Okay, clinical condition. We will call it clinical condition. Okay. Next, after that, the most important type of uh, uh, pathologies we have to know that is two types of diseases. That is TB, three types of diseases in the mostly in the large intestine. That is TB, bowel TB are most common nowadays, and Crohn's diseases it is also most common, and ulcer in colon, duodenum, anywhere it will happen, no issues. So bowel TB, Crohn's disease for diagnosis purpose, you have to do CT enterography. So we studied about CT enterography. So that is the important scan to be done for the diagnosis of CT enterography. For ulcer colitis, the investigation of choice is colonoscopy. The investigation of choice is colonoscopy. So with the help of colon scopy, endoscopy like colonoscopy, so you can easily diagnose the ulcer colitis if there is any problem. So let's discuss about all the things. So first we have this is the Crohn's disease. Okay, we will discuss. This is TB. Other where are the I have the image. Next is ulcer colitis. Okay, till that we'll discuss about these two things. First is interstitial tube TB. In the TB, it is not pulmonary TB. Pulmonary TB is it is the infection of lung, tuberculosis. It is happened to the ileocecal region where large intestine and small intestine meets mostly there happen. We have two types of TBs, that is ulcer type and hyperplastic type. So what are the clinical features? Upper abdomen, diarrhea, abdominal distension. Some symptoms are malnourished, pale, visible peristalsis, distal bowel loop, rolled up omentum, okay, mass in RIF, okay, and lumbar region management and treatment, sometimes surgery, okay. So bowel type TB or interstitial TB, how we diagnose this? Investigation of choice is CT enterography. CT enterography. Next type of disease is Crohn's disease. Is also very common nowadays. What will happen in the Crohn's disease? It is a immune mediated disease. Any will thing happen like ulcer will happen in the mouth, ulcer will happen in esophagus, ulcer will happen in small intestine, stomach, extra fat, extra thickening will happen in small intestine. Okay, or any extra wrapping, fat wrapping will happen to the large intestine. So anything will happen. Okay, so this is called ulcer. Sorry, not ulcer. This is called Crohn's disease. Okay, this is called Crohn's disease. So it is autoimmune disorder, Crohn's disease, and TB. TB is the infection of tuberculosis to the large intestine. So where small intestine and large intestine meets. So what is the investigation of choice? How we diagnose TB of intestine? How we diagnose Crohn's disease with the help of CT enterography? Already I told you that. So for soft tissues, we need CD enterography like inflammation, okay, everything in starting class. This is the last one, that is ulcerative colitis. In the colon, there is a formation of ulcer. It will start mostly in large intestine. So you can see that there are different types of ulcerative colitis: proctitis, proctosigmoiditis, distal colitis, pancolitis, extensive colitis. If some part of colon is if infected, we'll call rectum or anus proctitis. Sorry. If beneath 30%, or we will call it ascending transfer or descending colon. Descending colon is affected 1 by 4th. So we'll call proctosigmoiditis. Sigmoid colon also affected. Whole descending colon is affected, and rectum, sigmoid colon, and anus all is affected. So we'll call distal colitis. Transfer colon and descending colon, or sigmoid colon, and rectum, anus all are affected. We'll call extensive colitis. If whole large intestine is affected, so we'll call pancolitis. It is very, very dangerous. So, what is the investigation of choice for ulcerative colitis? Colonoscopy. Okay. From the rectum, the scopy is inserted. From that help, we will check the all the walls, thickening of walls of colon. Okay, so it is very, very important. Okay, so these are the important pathologies. One important pathologist that we missed to know about that is uh, acute appendicitis. That is acute appendicitis. So acute appendicitis, what is the investigation of choice? The investigation of choice is nothing but there is to do ultrasonography or CCT abdomen. Ultrasonography or CCT abdomen is the investigation of choice for acute appendicitis. So mostly ultrasonography is enough to see the appendix, whether the appendix is swollen, any swelling is there. Okay, and you have pain, unbearable pain, fever, vomitings. Okay, patient will have pain like when fish come out from the sea, how it will break down like that. The patient have unbearable pain. So that's the reason doctor will operate that. Okay. So acute appendicitis, the investigation of choice is ultrasonography. So we discuss esophageal pathologies. Like in the esophagus, we have esophageal cancer. Okay, diverticulation of esophagus, congenital diaphragmatic hernia. Okay, these are the important. Or esophageal ulcer, cancer, tumor, anything will happen. In the stomach, we have infantile hypertrophic pyloric stenosis, gastric ulcer, bowel obstruction, and in the gut, small intestine, large intestine, bowel TB, and ulcer, duodenal ulcer, and ulcer colitis, Crohn's disease, and acute appendicitis. So these are the important pathological conditions which we see in our clinics, in our hospitals, in our family. Most of the people is affected. Other also is there, but it's not important for us. Okay, it's mostly rare clinical conditions, or not rare, but some people will affected. But these conditions are affect on for 60 to 70, 80% people. Okay, so this is all about in today's class we discussed GIT pathologies, complete important pathologies. So we have next class tomorrow about liver gallbladder pathologies. So we will discuss tomorrow. So any doubts regarding that, kindly ask.